Hey everyone, welcome back to the Brokerage Inc podcast. I'm Gillen here with our Executive Vice President, Josh Slattery, for part two of our discussion on what's been going on in Medicare after the 2025 AEP. And in this episode, we're going to have a discussion on really looking forward into the future. We have a new presidential administration. We have the NABIP CapCon coming up. So we're going to talk a little bit about just industry trends with you guys. So Josh, where do we want to start?
Gosh, it's hard to say where to start. We have a lot of news that's been coming out. I think the sentiment is how much of this is really going to stick, how much of what we've seen come out from CMS in the proposed rule, in the notion that VBID is going to have significant changes. Will that actually play out because it was drafted by the prior administration? Right. And now we have new leadership coming into CMS. Will they take what has been published by the prior administration and just let it take effect? I think the answer to that is most likely no. You have Dr. Oz now running CMS, and I think he's going to want to bring in his own perspective on things. And so it'll be interesting to see kind of what actually comes to fruition. But certainly there's some things we can talk about today.
For the listeners that don't know anything about VBID, talk to us about what that is.
Yeah, so VBID is value-based insurance design. And what it does is allows the carriers to file D-SNP benefits based on income qualifications, as opposed to SSBCI, which is supplemental social benefits for the chronically ill, where a chronic illness can qualify them for a specific benefit, but then you have to look at prior claims, or you have to have a physician determine that they do have that chronic illness. So again, VBID just makes it much simpler for the carriers to qualify these individuals as opposed to SSBCI. And let's understand why they rolled this out, right? They feel like if they can correct some of these social issues, that'll then improve their health. What CMS said when they released the cancellation of VBID is it's been one of the most expensive, if not the most expensive program CMS has ever rolled out, with not a lot of benefits. They're not seeing more quality-based outcomes as a result of this program. I think there's some carriers that are advocating heavily right now to say, well, hold on, that's not necessarily the case. Let this program play out. How exactly are they looking at the data? So there's some back and forth happening right now with the carriers and CMS to really understand, why are we throwing out VBID? Let's really take a hard look at this, because there certainly is some value, as you can imagine, having, somebody with a very, very low income and chronically ill, that they have $0 generics, they have access to healthy food, that they can get transportation, right? They can have pest control. I mean, these are certainly services that population can't always afford, and that impacts their health.
Yeah, very true.
So I think with VBID, if it does go away, what happens? Then your healthy food card now, and a D-SNP member, they would have to verify that they're chronically ill. So it's meaning that not every D-SNP member is going to qualify. So you can't just go out to market and say, Mr. Smith, you're going to get this food card. It's, well, if you qualify, you'll get this food card.
Interesting.
And the SSBCI qualification process has caused a lot of consumers and agents heartburn, because in some cases there's bottlenecks at the carriers. It takes, a couple hours on the phone to get through, or you have to wait for the provider to, declare that they're chronically ill. So the carriers are trying to come up with ways to streamline it. One way is through Sunfire. They can identify, a medication that's been prescribed that would then indicate that they're chronically ill. They have previous claims data that they can use to say, okay, this person isn't, and they'll try to streamline it. But ultimately, it's going to make it more difficult to market and to become qualified. Also, the healthy food card would likely stick around, but utilities are strictly based on income. So utilities would no longer be available as part of that program. I think you'd also see that $0 generics will no longer be available to all duals. That is probably the most significant because these folks need to be on their medications. They need to be able to afford them. They're used to not paying anything. Even if it goes to, a few dollars, that can really impact the likelihood that they fill those drugs and can afford those drugs.
Right.
So carriers will maybe introduce that as a benefit for full duals, but anybody else that's below that full dual threshold who's enjoying the luxury of having, $0 generics today may not have them. The utilities aren't really that highly utilized. The carriers have given us that feedback. I mean, it's great to have on paper at the point of sale, but those are less utilized. We know that the healthy food card is highly utilized. In fact, members will switch, over $10, $20 a month. It's a big deal. So,
and it's really easy to connect the dots on that one. What you consume affects your health. Yeah. It's not a hard sell.
Yeah, that's exactly right. Yeah. But I don't think that the data is showing the value of that program. And so, of course, CMS is, and you can tell CMS is really focused on that DSNP market, right? So VBID off the table now. At the same time, they've created these new, SEP qualifications that you have to be fully integrated to make a switch. And we've already seen in some states where passive enrollment into the MMP, which is this Medicare Medicaid program, and if you're aging in and you become eligible for Medicare and Medicaid, and in a lot of states, they passively enroll you into a DSNP MMP plan. And those are non-commissionable. Those aren't, agents don't write them, but they compete with DSNP.
Right.
And so a lot of agents have been frustrated over MMP because, they enroll somebody and then they're passively, enrolled into another plan. They have to go back out and re-enroll them or they lose them altogether. A lot of states that participate in MMP, Texas being one of them, Ohio, there's a long list of them, they're looking at stopping passive enrollment into MMP and only allowing enrollment into integrated plans. So just as an example here in Texas, United Healthcare and Molina are the two largest with Medicaid contracts. You have a few other smaller local carriers that also participate, but they don't really have aggressive DSNP plans. If all of a sudden Texas said, you cannot have a DSNP in Texas unless you have Medicaid, then all of the Aetna membership, all of the Humana membership, any DSNP that's not integrated is now going to have to divest out of that market, and there's going to be a major landslide in books of business because, you're talking about tens of thousands of members that are going to have to choose a new plan. So a lot of activity happening in the DSNP market. The states are all acting a little bit differently. Some are fully integrated. Some are highly integrated. Some wrap Medicaid around the DSNP choice. So if you choose a DSNP plan, then they bring in that Medicaid provider. So as an agent, you really have to understand how the state you operate in functions. Who are the carriers that have full integration? And oh, by the way, guess what? Sunfire kind of helps you figure all that out. So we've seen more utilization this year with our Simply Enroll tool, Sunfire, than ever before. And I think that's going to continue to grow because agents need to figure out these SEPs. They don't, and also, generate SEPs for like incarceration or a recent move, so it's becoming a tool that really helps you identify when that SEP is. Not to mention helps you calculate, the Part D benefit, the MOOP, and all those things that are much more challenging now.
Yeah, at this point, Sunfire is a no-brainer.
Yeah, exactly. And we have it integrated with Medicare Pro and Agency Block. So if you really want to use a CRM effectively, use one that's integrated, right, with this enrollment tool. Saves you all of the extra work of entering in the data. you pull up Part A and B effective dates, you pull up their Medicaid level, you pull up current plan, previous plan, and now all that data just moves right into your CRM.
Yep. And we saw a big uptick in utilization on that new drug intake form this year too, where you can just send your clients. Basically, if you guys don't know, you haven't checked this out, it's basically an update form. You send them a link and they put in their prescriptions and it automatically syncs to their Sunfire profile. Boom. So when it comes to like, as you're growing that book of business, the next AEP comes around, we've had people say, gosh, we should probably do a case study on how many hours that saved people. Because it made a big difference this AEP for sure.
Absolutely. And I think you're going to see Sunfire continue to evolve, more and more enhancements on the roadmap just to, handle some of these market changes that we're all dealing with.
Yeah, for sure.
The other thing is this time last year, we were really stressed about the proposed rule, right? The proposed rule from last year was packed through all sorts of compensation changes. Of course, more marketing requirements. In the previous Trump administration, we saw less regulation, right? The 48-hour rule went away. The disclaimers, weren't there. There was talks that the scope of appointment was going to go away completely. And then in the Biden administration, we saw, more regulation. So it'll be interesting to see how some of those call recordings, 48-hour rule disclaimers, play out in his current administration. But the proposed rule that just came out has some things that we certainly should address. And again, going back to my original comments, will this actually come to fruition? We don't know, but it's certainly in the proposed rule, and the final rule will be released sometime in April, and that's when we know what really sticks. And so what is in that proposed rule? One is the GLP-1s are being forced onto the Medicare formulary. So your Ozempics, your Mounjaros, which we know are very expensive medications. Weight loss drugs are already prohibited from Medicare formulary. So, there's a debate on should GLP-1s really be included in the Medicare formulary. So that's one piece that we'll see if it makes the light of day in the final rule. But as it's proposed, those will be required to be in the Medicare formulary. So all plans will have to embrace GLP-1s, and that comes with a big price tag.
It's the idea there that, yeah, it's a more expensive drug, but it'll reduce claim costs down the line, kind of a thing.
Yeah. I think so. Okay. I think that that's probably the rationale. But, we know that it's really expensive. And again, if that was the case, maybe it does help somebody get their diabetes under control. Why wouldn't they have allowed some of these other medications that do something similar in the past? The other thing is that, carriers are using debit cards more often. When you look at OTC benefits, you look at the food card, there's some language in there that mandates carriers to allow out-of-network retailers. So, maybe like a Target isn't in the network, and now, they're requiring that they allow them to use them at those locations. So that could also, cause some cost pressures. They don't necessarily have contracts with those, or they're going to have to go out and get contracts with more retailers. That could drive the benefit down for the consumer. So that's another one that I think, we can keep a close eye on. The one that probably impacts all of us the most as agents is the marketing rules. They're saying now that pretty much anything that's categorized as communications, right now you have to send any marketing material through CMS for approval if it has benefit information or if it's used essentially to generate a lead. We send it through HPMS. We get it approved, the carrier opts in, we put a code on it, and now it's available for the agent to use. Now CMS is saying regardless of what it is, a business card, a generic ad, anything on your website, 100% of everything has to go through HPMS for approval. So as you can imagine the bottleneck that's going to occur there's
no way that it's going to go in this next administration.
Exactly.
Because, not to be political, but that sounds like just a job creation scheme
Right.
Like, well, we got to hire a bunch of federal employees to do all these tasks.
Right.
And that's like the opposite of what's happening right now. They're kind of doing a purge. There's no way that.
Yeah, and I think, you have a notion that there's some commercials that are generally deployed by call centers that can be misleading.
Mm-hmm.
And because of the deception in some of these marketing practices, now we need to review everything. So that's the other side of that argument, which is we know it's going to cause more work on CMS, the carriers, us as FMOs, but it's to really protect the consumer.
Right.
But I agree with you. I think that this is one that we likely will not see the light of day.
The idea that you would have to send your business card to CMS is just, that's cray-cray.
Right. No more red, white, and blue business cards, folks, that say you're from Medicare. I mean, those are the kind of things, they cite, the usage of like the Medicare logo and, in the colors. So they want to review everything now to make sure there's just nobody trying to misrepresent themselves.
Right. And you could see certainly arguments from both sides. Like, there are bad actors who are using that to mislead, but we know plenty of agents. They're just using that so the consumer knows what they do.
Yeah.
So they can connect the dots. Like, I'm the Medicare person.
Exactly.
They're not trying to trick them.
Yeah.
So it's all on how you look at it.
And we found responsible ways to use the Medicare card, right? I mean, we can still kind of just use red, white, and blue color schemes and get the message across, to your point, to the recognition of what it is we do.
If I'm at an event or whatever, like, just what's going to stop the person that's walking by my booth or whatever? They have to have something to connect to them, and that's usually the best way.
Yeah.
It's that card they're used to seeing.
That's the card they have in their wallet.
Yeah.
Then the last thing I would say, just to look at in terms of the proposed rule, is they are trying to make the SSBCI qualification process more difficult. They're putting more of an in-depth process in place, and a lot of carriers are saying, well, hold on, time out. You want to make it more difficult to qualify for SSBCI. At the same time, you want to do away with VBID. This isn't the right time. If we're going to have to shift everything to this SSBCI qualifier, let's keep it as it is today, not make it more complex. So, the four things, just keep your eye on what the proposed rules: the GLP-1 coverage, the debit card rules, the marketing communication review, and then the SSBCI qualifiers. Compared to last year, it's nothing to be alarmed about. Again, will any of this even see, the light of day when the final rule comes out? I highly doubt it, but it's worth just talking about so we can keep up to date on, what is it that we're having to face in the future if this all does go through.
Right. Well, to start wrapping up, you're going to CapCon soon?
Yeah, so we'll be in CapCon into this month. We're excited. It looks like a great agenda this year. A lot of, hopefully perspective on what CMS, what they're focused on. The nice thing about CapCon is that they talk a lot about not only Medicare, but the ACA as well. We know that, in certain cases, the Republican administrations are anti-ACA and more pro-MA. So will that be how, things play out this year? I don't think so. Trump has always said he saved the ACA when he inherited it from the Obama administration. So I think he wants to, keep the subsidies alive. That's the big thing hinging with the ACA, is will those subsidies expire? If they do, it's majorly disruptive for that marketplace. But I think that if I were to guess, he keeps them at least stable.
Yeah.
But more to come. We'll do a recap when we get back from CapCon and hopefully bring you some more good information from the Hill.
Great. Well, thank you, Josh, for your time and all of your knowledge, sharing that with us here. And we will see you guys next time.
Thank you.